Hello and welcome to the Josh Tills Coaching Podcast. I'm Josh Tills and it is my pleasure to welcome a very good friend of mine and a personal mentor of mine, Mr. Tom Sparks. Tom is someone that I've known for probably about 7 years or so maybe now.
It'd be pre-Edinburgh, so it'd be a while now.
Yeah, 100%. And as I say, he's been a personal mentor to me for the majority of that time and equally a really good friend. I'm grateful to have you here, sort of firstly, Tom, and just sort of give a bit of introduction to yourself. I know that you're Master of Osteopathy, Masters in Nutrition, ex-British powerlifting champion, purple belt in Jiu-Jitsu, a fellowship in applied functional science with the Gray Institute, loving fiance, loving dad, all of that. Anything else that I've missed that I should add up?
No, that'll do. I'll take that. I'll take that. Sounds all right.
When you sort of put it all together and you sort of like go through that resume there, I think it just sort of like speaks to the credibility about sort of everything that hopefully we're going to discuss today, and just sort of how influential I think you've been on my growth and my development in this health and fitness industry. And then hopefully we'll pick on some topics that hopefully the sort of audience can sort of take away and sort of have a few takeaways from what we discussed today. And there's sort of loads that I'd love to sort of pick your brains on. But,
sounds good.
But yeah,
I feel just before we start, but I can't remember which episode it was. Might have been 2 or 3 or something. There was a comment made that seemed like I was the rudest guy, bursting in, didn't even know me. You're doing your job.
I think this is episode 1, where I was saying about having some guests on.
But I need to clear this up.
Let's get the record straight.
Contextually, it was a little bit different from my point of view, right? So I went to the gym that ultimately you were working at, right? And I was on a neighbouring piece of equipment, right? And on that particular day, I didn't have music in, so I could ultimately hear what was going on. And I noticed that I can't even remember who it was. But
It was a client, Carl Bate. I remember.
Yeah, it was a guy.
He was a taller guy. Yeah, he was a taller gentleman, and we were squatting in the squat rack.
That was it. Yeah, and he was making a few remarks about, I think, pain and how he was feeling it, and he was having a bit of difficulty with a sort of squat option or something that you guys are doing, and you were doing all the right things actually, in the context of like a PT, just like trying to scale it and so forth. And I could see that there was a bit of not frustration with yourself, but like he wasn't quite feeling as comfortable as you'd like him to feel.
For sure.
So part of me actually felt like
you had an obligation.
Yeah. Like it came across really well, and I really liked the intent, and I was like, guys, if I may, I kind of overheard all this, and if you wouldn't mind. And to be fair, if it was me, I'd have just nodded and said, cheers, mate, fuck off. You know? So you still obliged me, but at the end of the day, I think ultimately we then got some success. He was happier. You were kind of like, oh, who's this guy? And
I think
a friendship started.
100%, yeah, definitely. There is absolutely no qualms from my perspective about the initiation of that interaction or anything sort of from that standpoint. I think when I reflect back, I think you were heavy in a dieting phase at that standpoint as well.
I was a little grumpy then,
you were in the trenches as well, and this was like 6 o'clock in the morning. You've come in, body in some squats. You had those little like 4-inch shorts on with the knee wraps on and everything. Body in some weight, as you will normally find Tom doing. And then I think where I'd already heard a little bit about you, I think from like just other PTs. I think it was mainly Courtney. And I think Courtney had known you from sort of the Hatfield area and stuff like that. And he sort of said, "Oh, like Tom's back sort of training in this gym now and stuff." And like, yeah. Sick guy, knows all of this stuff. So like, I'd already heard a little bit like about you from that standpoint. So when you came in, I was like, oh well, this is someone to learn off as well. And I think I ended that interaction being like, could I pick your brain on like a few more stuff? And I remember I'd just gone on a course, and it was all about myofascial lines.
Oh yeah.
And I think I sat down with you in like the caf, and I was like, oh, like I've just come off of this course, like anatomy trains, myofascial lines. What do you think? And I was like all enthusiastic.
I know.
You were like,
remember that now.
Yeah, sack it.
Yeah, it was tough. I think in a weird way, it was almost like perfect context, because I was a bit grumpy back then, because I was obviously like quite into that particular phase where I was fancy just doing a bit of a diet. So I was a bit more cutthroat than perhaps I might have been, where I was a bit like, nah, fuck it, no, we don't worry about it. But to be fair, around that time, I think that was kind of where, because you were so enthusiastic, and I did feel a little bit bad that I was kind of, you know, not rubbishing what you were learning, but rubbishing what you were learning. Yeah. I was kind of like, I will spend some time. So then we did quite a lot of
mate,
sort of
reflecting on that time. We went through so much.
I tried to, because I knew I was going away.
Yeah,
at Edinburgh at that point, that like you had a lot of questions, and I could really appreciate that, and I wanted to give you a lot, knowing that if I'm away, at least if you wanted to ask me something about a certain person or a client you're having problems, there would have been something for you to lean on. And do you remember when we did X? So. We did do quite a lot of that around that time.
I think like just contextually, like the amount that we fit into that time, and like now knowing sort of being a kind of formal student again, and like probably sounds quite arrogant, but just kind of blowing my own trumpet for a second, I feel like there's probably quite a few people on the course that I'm in the osteopathy course where, dare I say, I'm a little bit further ahead than them, given kind of everything that I've done in the length of time that I've worked in the industry. And so like sometimes someone will ask a question, and like I'll think like that's not particularly relevant, and then I kind of put myself in your shoes like 7 years ago when I must have been asking these questions, and you were like, mate, this kid's like way off track. He's asking like the wrong questions. But I think when we look at like that nurturing of like my brain into the industry, into like sort of what I know now, I think you did like such a good patient job, like steering me in the right directions, giving me like good recommended reading to go on to.
That's it.
To then sort of like shape my thought process today, and then it's gone to different people and to different things as well.
It's popular now. Like a lot of like influential figures in healthcare now use a bit of shock value and a bit of that's shit, that's crap. But sometimes what they really mean is there's a place. But I think to grab attention, it comes across a bit excessive. I think in some ways that kind of creates two camps, right? It creates a camp that maybe go, oh, I'm going to reflect a little bit, and maybe he's got something to say, and that's usually because they like the personality or person. But it also pushes people away, right? So that's where maybe in the practical way, in the real world, a bit of a just maybe start with this and this, and then let's ask some questions, and then here's a bit more, and then and by the way, here's the dark arts, you know. It's kind of like it's got to be a graded thing, I think, but it does. I think it's more. I think what we were starting to do with in the beginning, more than anything else, was we were just trying to broadly change concepts and ideas more than things that we should be doing. And I think that's kind of served you actually quite well, as I've seen you develop as a PT, because I would say that you're one of the strongest PTs I know because of all of that.
Oh, really? Wow, that's
well, just because you'd be reflecting and looking at people in the right way, and like not spouting rubbish, but it would have a nice overarching message, right? But you know, even though I'm sure you don't mind me disclosing, but
no, of course,
a few concerns that about coming into this space, like, you know, how am I going to feel? You know, I feel like I'm aware of this, but I'm being taught that. Do I abandon that and go with you? And it's actually like, well, weirdly, you've kind of almost been exposed to running before you've walked. And I think what we're trying to do now is sort of say, this is all going to serve you, but we can't really say that's rubbish until you know what come before it. So
of course, and I feel
you're
as
in that
though
kind of weird space now.
Like I won't know the relevance of that until I'm past it.
Yeah,
and like it's like I'm taking faith that there's going to be that light bulb aha moment of like it's all come full circle.
Yeah,
and like, oh, actually now I can see the deeper level to potentially what I've learned before, and how it kind of further instills my bias, and like I make kind of no mistakes about it. Like the way that I treat or the way that I train people has my lens and my bias on top of it. But that's kind of a bit of a lens on top of a lens on top of a lens. It's all shaped by the experiences, the knowledge, the context of the person, and all of those things.
Exactly.
But that all comes together right at the end, I feel like, and potentially once I'm very much looking forward to getting into clinic year 3 and 4 and potentially starting to impose some of the sort of like the non-spoken, and like I'm sure that they are spoken about, but almost sort of like the communication side and building rapport. And I think it's something that I want to speak to you today. It's something I want to speak to you today about is kind of having that patient or client buy-in, and I think how much that can shape outcomes. And I feel like building rapport and kind of establishing credibility and kind of buying into that relationship is such a valuable thing. And it's something that I've got such a lot of experience from by working on a gym floor and approaching people and stuff like that.
That's what I mean. That's why I feel like what I mean is like there are a lot of skills that are there that aren't taught in a classical sense, and those who sort of do well, or even arguably even some of the students we were teaching last year who got like some of the best grades, or even someone who got a bit of an award, ultimately were the best communicators. And that wasn't just who was academically the best. It was like actually at the very, very end, those who could go in, interact with people, communicate with people on a level that was just different, did the best.
Yeah, 100%.
You know? And it's kind of weird, like, just sorry to add.
So, no, go.
Even when I think about my own sort of respective journey in clinic from when I graduated to now, I'd say like you go through this sort of version of trying to upskill skills, but like the last couple of years, everything has been about how I talk and interact with my patients. And actually, as a singular thing that I've implemented in the last couple of years, I'd say that's given me like the biggest transformation in clinic private practice for sure.
Yeah. So. And I think like so far there's kind of like a couple of things I think that I'd like to add early on is that one, I feel like this is quite an appropriate space for us to be recording this podcast. I feel like I mentioned it on episode 4 I think, but obviously this is kind of where your osteopathic journey started. I know that you studied here and then like kind of have like evolved into maturing and sort of mentoring me to then into me studying here now as well. I feel like it's quite special to sort of be here together almost. And
I feel sort of like I'd have to shout out like the kind of circle of these things, because I became an osteopath because of Andy. He inspired me, and I came here, and it's kind of nice in some weird way that like you know, everyone who I arguably help is because Andy led me on that road, and now I feel pretty cool that you feel like you want to embark. Is that kind of
like passing of the torch almost, and like sort of who knows,
need more people to wave that flag.
Who knows, maybe in like 8 years I'll kind of be sitting where you're sitting with sort of like someone else
that
is now studying.
Some guy come watching it, I want to do that.
Exactly, 100%. And then I think kind of moving on, I think into just sort of touching on where you've had such a kind of focus on the communication piece and sort of building rapport and establishing that relationship with patients in sort of a clinical setting. It's definitely something that I wanted to talk a big topic on today. And while sort of we're talking at it at the British College of Osteopathic Medicine and probably with a little bit of an osteopathy lens, I know that you are a big advocate for movement-led therapy, and like I don't necessarily want to say like hands-off therapy, because I know that obviously it comes down to the patient in terms of what they need, and like I know that you'll sing that hymn sheet more than anyone, but I think that you're not someone who's going to come in, give someone a rub and like, right, I'll sort of see you next week. It's probably giving them the tools and the utilities that they need to have an active participation in their therapy, in their recovery, in their rehab, and sort of just wanted to kind of talk mainly about one, how you can establish that buy-in, and sort of why you think it's kind of so important. And I'm hoping that will sort of blend into another topic that I want to talk about later on.
Yeah, so ironically, like everything starts off a story. Like the second they turn up, it's a narrative. That is communication. Do you see what I mean? So like straight away, even at that point, it's really important that when we're thinking about communication, we've got to establish my ability to talk to say patient, and patient to talk to me, and I listen. Yeah. So with case histories, for example, I tend to like them to be quite open. And what I mean by that is very patient-led. So often, again, if we're putting a bit of a clinical lens, or even just maybe even PT, we put words on top of other people. Oh, you mean this, you mean this, you mean this. No, I meant that, you know. So sometimes when I hear patients tell their story, like they're really telling me a lot. And sometimes they give me all the information I need. Sometimes I have to then zoom in a bit.
Yeah.
But it's interesting that even in the story, you can clearly see that like you become a bit of a master at picking up the subtleties of what someone's really saying, because there's words spoken and then perhaps what that means to them in a context. So for example, it's not uncommon that you see a patient and then they'll be telling this sort of story about what's been happening, how it's been going, and then all of a sudden they'll be really specific about a few things, and you can tell straight away that actually what they're really asking me is, I'm concerned about this for these reasons, or I have worries about this. What does that mean for me?
Yeah.
So rather than just pick up on that and address it there and then, I just park that. That's the listening part. You're parking important pieces of information from like a medical lens, and like what do we need to do here, but also what's personal to them.
Yeah.
And then the other skill is for me to do anything with a patient, or even in a PT context, right? It's through what I say and I do that ultimately builds confidence for one, but also directs where we go. Yeah. And patients or even people will have a preconceived idea when they walk in the door. So there's already a lot to contend with, right? So
it's like 3 or 4 narratives going on.
Yeah, there's a lot of like sub sort of sections to communication in some ways.
Yeah.
And let's say, for example, we've picked up on some of these as we go. If I can make someone feel heard, listened to, reassured, in a very quick space of time, they already feel value quite quickly. Because often when I hear patients talk, they're like, "Oh, the GP doesn't care, consultants don't give a shit."
It's such a like an interesting window, isn't it, to sort of like greater healthcare and that sort of like primary versus secondary healthcare in terms of where we sit in that, like one as osteopaths, but equally I'd say like equally as a personal trainer, where there's so much contact time given. Like obviously as a PT, I could see someone upwards, like minimum probably once a week, but potentially sometimes upwards of 3 to 4 times a week.
You might even know them better than their GP. Really. Whether or not you have the knowledge to understand what's relevant. But
and to stack things on top of each other.
In reality, you could probably, like on behalf of your client, give your GP a really good record of what they're about and what they're doing.
So, and I think I spoke about it on the stress episode, like mainly talking about allostatic load, and you sort of introduced me to that topic anyway, and I'm sure that will come up today as well. But this almost sort of like sometimes the listening piece being so much more important. And there was a clip that I put out of almost like you go to the GP, especially from like a stress standpoint, and the GP might be like, "Oh, you're a bit stressed, are you? Like, have you tried having a cup of tea?" Like, and I think people can feel not listened to or not heard, or like these cookie cutter approaches to their very real situations and their very real lives. And so I think taking the time to do that and to listen and to hear them, not necessarily hear their prognosis or to hear their symptoms, but to hear them.
That's it.
I think
because I think this is a thing, right? Like think about any breakdown in communication, you just haven't essentially felt heard. Like that's it. That's essentially the crux of it, right? And more often than not, if you genuinely listen and respond accordingly, not in like a forced way, but just if you're present and you're listening, you're gonna be aware of what's important for them, right? So straight away they almost feel like, this person's paying attention to me, this is a good thing. So, rather than like they're telling a story that's clearly personal, rather than closing off. So just tell me, penny, pins and needles, numbers, tingling, funny sensations into lower extremity. Like you've nipped all of that. Yeah. You've made it about you because you want the facts. Yeah. And there's a time for that. But again, like
I can imagine there's challenges, and obviously I sort of without being in a clinical setting, there's obviously the challenges to time and to the next patient that's sitting in a waiting room, sort of like who knows,
You're always trying to do the best job you can, and that's not to say that I get it right all the time. I'm not saying that everyone gets it right, but I think people who are good at communicating, at least generally speaking, can recognise when it's veering off. Yeah. And how do I bring this back? Yeah. Or if I say something and it hasn't quite landed, I've got to be able to recognise that very quickly and change to kind of get there. And I just think over time you start to become a bit more savvy to when that's happening. And then when we think about buy-in, right? If I've understood, heard, and I use And I can demonstrate that. Well, you mentioned, and just to be clear, you said this. Am I right in thinking that? Yeah, okay, cool.
I think using their words to them as well, like using the patient's or the client's language back to them,
100%. Shows you've listened.
Reaffirms it, doesn't it?
Yeah. And then that makes me want to feel like we need to explore this, and this because of those things.
Yeah.
And they go, okay, you know, and then it's like, let's say, for example, we then impose, okay, now we're looking at assessment now. So then you've got, or even in training, we've got.
I mean, that would always start like a consultation first,
frontal
like a
plane,
training.
transverse plane, or medical language like internal, external rotation, side bending, lateral flexion, whatever it is, orthopedic testing or whatever. Like it doesn't mean anything to patients. Right?
I was just about
doesn't mean it. It means something to you. So, like, it's really important at that point then, even when I'm doing assessment and stuff, like, even though it to us, in my mind, it might be more complicated, I don't need to make things complicated as a narrative outwardly. Because, like, medicine loves to zoom in. Like, if you think of Russian dolls,
Yeah.
Medicine will go all the way in.
Yeah.
All the way. Yeah? So, for example, atherosclerosis, the medicine is like, oh, well, you know, inflammation of the lumen, and then it's a deposits of this, and then build up a back, blah, 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 blah. But, like, to John, his atherosclerosis is, I'll just get out of breath when I go to the shops. You know, they're very far away, right?
Yeah.
So, in that context, we're just saying, look, I'm just going to get you to do a bit of a move.
Yeah.
I'm going to ask you to do a few movements. If any don't really make sense, don't worry. But there's no right and wrong here. You don't have to do it any which way. Let's just go with it and see what happens. Yeah. It's very loose. It's not about like formalities. Okay, we're just going to have a bit of a look at the knee now, and we're just going to test a few of the ligaments. I'm going to be putting a leg in a few different places. Just let me know if any pain was stiff in any position, and we'll go at a pace that feels right for you. And then we'll do that, and then say, well, based on this assessment, everything's looking all right. You know, this ligament, we could go zoomed in for some people. We might keep it very far out.
I think this is sort of something that I was going to note is that you sort of have to recognise the person in front of you, and it's like some people, when I'm training them, want the terminology and they want the jargon and they sort of want to understand, but then others just want the end product, right? Like their goal is to lose 5 pounds of fat. They don't care what a calorie deficit means and this and the other. They just want the end result of losing 5 pounds of fat. So I'm going to give you this, and this. Do it, 5 pounds of fat lost or whatever. Same way for a bad back or a bad shoulder.
People don't know what they don't know, right?
Yeah.
And this is a thing. And I think, again, this is the other skill, communication. So addressing your communication style to the person in front of you. So, for example, if someone comes in and starts giving me medical language, I already have a few clues now because you've obviously interacted with people before and you've done your own level of research, or you might have done Google Doctor or something, right?
Or potentially, like, you might have just seen that many other clinicians and you've heard these terms, but do you, like, that's equally like you might have seen a physio, an osteo, a chiro, a GP, a sports therapist, and they've all been told about
different things,
this ligament or this or like this nerve that's being impinged or something, and it's like you're like sort of are you repeating, or sort of do you have that level of comprehension and that understanding am I going to communicate back to you in that, or are we sort of going to piece together that actually this is a repetition from Google, from Instagram, from other clinicians and other influences, from what happened to my Uncle John, whatever it might be, you know?
Exactly that. And I feel like say for example, patients can kind of say certain language, and I might start pitching things at maybe a level that involves some more complicated themes. So spinal mechanics, for example, in people's backs, right? And we're looking at real and relative motion, and we're looking at top-down and bottom-up spinal mechanics, and that can feel a bit like, whoa, we're already going over my head a bit, right? But, you know, some people kind of are really interested by that, engaged by that, and they kind of, if you prompt them with certain things, they kind of go, okay, I understand what you mean here. Whereas others, for example, I might just be more like passive and a kind of visual. Yeah. If my body has a bit of a tendency to do this, there's a bit of a curve in my neck now. Yeah. You know, I haven't moved my neck, but there is a relative change here. So I can say the same thing for two different people in two different ways. Yeah. Depending on a bit of a, I'm going to throw something out there. Did it land? Okay, and then I adjust.
For sure.
Same thing for metaphors, analogies. even when you're coaching cues, external cues or internal cues. It could be goal-driven or an internal narrative. It's the same thing with how I'm explaining something. So if we've already spoken about, I don't know, I like what are your hobbies or something, and they talk about, I like cars or something, I go, we mentioned obviously about the driving, right? So if we think about pain, right, if the road that's near me is the M40, if the M40 was gridlocked with, and do you know what I mean? You try and make it feel like something that makes sense for them.
100%. I think that where there's we look at the communication piece, and you kind of go into one sort of using the client's language, so that that sort of metaphor, that analogy, and as you said, sort of like drive in there. But also, I think from I think that there's like the non-verbal communication as well, and I feel like there's times, especially from like a pain standpoint and like an injury standpoint, where I can't raise my arm up. But can we fix the arm? Can we move the body around it? And you might show something, and they go, well, how's that worked then?
Yeah.
Because it's like, now you're like, well, you've got into the same position, but we've moved around it. And you might not necessarily explain, can you do this instead? And you try to explain it. But you just go, what I just want you to do for me is I want you to fix your arm, and I want you to try to bend around it. And then you can be like, now your shoulder has gone into that same position. Was there any pain there? Oh, that's funny. How'd you get me to do it? Like, how's that work? And so you could like, sometimes their own curiosity in like how you've managed to get them to do something that they haven't been able to do before can then lead into the kind of nuts and bolts of how and why, and that gets that buy-in as well, because you've proven something to them, haven't you? It's like, well, I couldn't do this before, and now all of a sudden I can.
There's a few layers there, because it's like, how do you learn, right? And like, obviously in our context, we're not trying to go too crazy, but some people are verbal, some people are visual, some people are a bit more like, I gotta feel it,
kinematic.
And that's the same thing with coaching. Is it, if I say like, when you move here, I'm just going to put my hand here, I just want you to feel it connect to this area, or like, I just want you to spread the floor, or is it chest up? Do you know what I mean? Like, you just have to have like a few versions ready to sort of help someone get somewhere, rather than feel frustrated that you're not. Just keep refining. And again, it makes this like assumption that like it's perfect. I think the beauty of sometimes follow-up healthcare is what I always sometimes find fascinating is I think, I've really explained that well. I think they really got it. When they left, they said that they knew. And they'll come back and they'll say, Tom, you said this thing, and I was like, I didn't say that. I would never say that, But it's just lacking context, right? And this is a thing, like, it just shows the power of your words. And like, even though we're trying to do a masterful job of full listen and full explanation in a way that feels right for them, they're not masters of communication. They might cherry pick. So it's an ongoing thing. And that might be the value in health.
It almost becomes like a semi-Chinese whisper, but like in their own brain, right? And it's like, if you have 60 minutes with someone, or even 30 minutes, 45 minutes, something, and you say so many things, and it's like all of a sudden, I don't know, you might have Mary, and she goes back to her husband, and her husband goes, how'd you get on with the osteo? Or sort of, how'd you get on with your PT? And, he said this, and like, as you say, like, they've cherry-picked 3 or 4 things. And then by sort of saying it to their husband, they've come up with their own
version.
Yeah.
And this comes back to what we were saying earlier, right? About communication and obviously like doing good stuff and bad stuff. And this comes back to the concepts and key messages, right? So no matter how masterful we are of all of these things, or we try our best, patients will always take bits. But those bits need to be the bits that are important bits.
Yeah.
I don't want to, and I think that's what we're trying to get at, is like, there's a place for everything, arguably, maybe, something definitely not. But generally speaking, you just want someone. I almost do it on the premise that if I never see you again, like, what's the overarching theme here?
Yeah.
Because I feel like maybe more in a healthcare space than anything else, particularly with patients that have never really been injured before, or had a lot of acute
their first experience of pain,
like that, you can set them up in a way where they might respond in a real positive, proactive way indefinitely, because you set the tone.
Yeah.
Whereas you get someone who then immediately is like, you got them. Got problems here, and it goes down a certain road. And I just think that we have a responsibility sometimes, particularly with the way that we communicate, that even if they cherry pick the overarching theme is, even though she might have gone, oh yeah, Tom said like probably shouldn't be doing this, the overarching theme is still that she shouldn't be scared of her back and that she should be just creating a bit of movement. She should be proactively involved. He did give me all these exercises though.
Yeah.
Do you know what I'm trying to say?
100%.
So I think like that's the difficulty, right? And that's why it's why so hard to teach, because it's personable, it's one-on-one, it's completely different every time.
Yeah.
Even though sometimes I hear myself say similar things, just because you refine a process over time, it's so individual. So I can't possibly give someone a recipe.
Yeah.
But if you understand maybe the important key concepts,
yeah,
and you're making active efforts to lean towards them more,
yeah,
you're probably going to have someone who feels heard, listened. You're going to have buy-in. I don't really like that way of saying it, but like investment in each other.
Yeah.
And then you're going to have someone who's more open to feeling confident in your plan for them.
Yeah.
Because you ultimately become responsible for their health in a context or in a broader fitness context, right? So that's quite it's a place of privilege, really.
100%.
And particularly with pain, it's grounded in suffering and not feeling great. So it's very laced with emotion for people. Yeah. It's their identity, it's their functionality. It can be lots of things. So
I think when you like take into appreciation like the bio-psycho-social model of pain, and like part of me recently has almost like become a bit like not necessarily like you sort of have to appreciate that lens, but I feel like the bio-psycho-social model of pain has become so much like utilised in recent times, which I think is great, and like the amount of people you hear talking about, but like I think more on like, and this might just be my following in terms of like who I see. I see a lot of people kind of like talking about the bio-psycho-social model of pain.
I'll jump in there because I don't want you to think I'm going down a certain road. Okay. I'm not discrediting it, and I think there's value in it for sure. But I do think just a bit of a gripe with the biopsychosocial thing. We all recognise and go, okay, yeah, look, it's more than just the tissues and stuff, and that's great. But it still feels like an afterthought for me, outwardly. For other people, it's still like, oh yeah, but you know, he's a bit sad and you know, he's got some things going on in his life. It's just a bit of a second. You could eat a bit better and probably do a bit more sleep. Yeah, it's a bit of an afterthought, whereas it's not truly dominated in the context in which it like almost equally. Do you see what I'm saying? So that's all I.
No, for sure. Like, and I feel as though like it has different weightings, not necessarily like, but different parts of the BSP model of pain have different weightings for different people as well, right? So like someone with acute injury, like if they've experienced pain before, like potentially how severe the pain, like versus someone with chronic pain, I feel like the chronic pain element, there's more to unpick from a bio-psycho-social model of pain versus acute injury. Is this just normal tissue damage that's going to heal in its own right and we can just make it feel a bit more relaxed versus, oh, well, you had an auntie who had back pain and it turned out to be like a tumour or sort of like that all of a sudden has a lot more weighting in my mind. And so I think it's great that I think more people are becoming aware of like the many more attributes and layers to pain and injury. But I think equally like it still comes back to the patient that we're seeing or the client that I'm seeing wanting the end result. And if it's that their knee feels a bit healthier and a bit better after that treatment, like, we can spruce in some of the this kind of ideology of pain, this ideology of movement.
It's interesting, isn't it? Because I think like we have to have a framework to show people, to say like these are the things that you should consider or become more aware of, right? So when you see it, you're like, okay, that's great, I'll become aware of it now and I'm thinking about it a bit more. But then it's like, but how do I really implement that? And then it comes down to like, it becomes quite complicated, right? Because it requires context. It's almost like clinical reasoning all the time. And then when you actually look like further ahead, so like that's research that's saying now, and then we're looking at how effective that is, but even though there's no real clear guideline for what that really is. And you look a bit further forward to what like people are looking to next, and it's more philosophical and more about embodied consciousness and about you're essentially talking to a conscious body that is experiencing something. And that it sounds a bit far out there, but really it just comes down to about people and communicating.
I think I remember you saying, and like we've not really necessarily spoken about Andy, your kind of mentor as well, and someone that I've met. But I think the last time we kind of really kind of brought him up together, I know he's still doing his doctorate.
Yeah, it's good.
And so, but I think I remember you saying that he was sort of diving down these routes of like, well, like if your pain could talk, what would it say? And like, is that kind of a similar theme to sort of what?
He's very much going down the communication style of things and how important that narrative is, and perhaps that's the important thing here, because like again, it comes about blending things together, right? So if there's a hierarchy, and we tend to in medicine place the hierarchy on like a bit of a tissue dimension, right? He's just slightly rearranged or trying to refine
the pyramid
dimension. So that's because obviously when we're talking about like persistent pain, chronic pain, things like that, we start to deviate outside of the norm of something that's predictable in a tissue level, right? So sometimes, again, this is where clinical decision making, being a bit more critically thinking, a bit more sort of contextually driven. Like if someone comes in with a very tissue-based type of injury, like that sort of knowledge just means, okay, there's a predictable nature to certain things here.
Yeah.
And then when you talk to someone, and largely things are dramatic and very, mate, I just took a massive tackle to my knee, mate. I just want to play football, It can feel it can be quite simple. It could almost be a bit orthopedic at times.
Yeah.
And it can be that you can lean on protocols a bit more, and they all exist, ACL recoveries, etc., etc. But even amongst that, there'll still be a bit of a journey, and that journey is quite subjective, and there'll still be elements where those things will become relevant, and things might become more or less relevant, and that's where perhaps the allostatic type of stuff becomes relevant, the dietary stuff becomes more relevant, maybe biomechanics in certain contexts become more relevant. But when you start, certainly when you start deviating towards maybe the normal person, and certainly with persistent things, the other things become almost more relevant sometimes. Yeah. Do you know what I mean? Like,
for sure.
I'm almost not interested. There's a bit of a movement now about de-diagnosis, for example, where
does the diagnosis really matter, or like
So essentially, it's saying if a diagnosis, telling a patient essentially like a diagnosis with a label, and maybe the images that come with that, or the social narrative that comes with that in our society, right? So when people think about back pain, you think in images, you think in discs and all that shit, right? It's unhelpful. But if it doesn't serve them in a beneficial way for knowing, and it's essentially in like a non-specific kind of remit, not really that worried. It's on this is going to be fine. Like, do we really want to medicalise it too much? Do you know what I mean? So sometimes, I treated a guy recently, a bit of an acute bout of back pain, and I jokingly, I kind of, initially when I formed my diagnosis, I said to him, do you want my diagnosis? And he said, yeah. I said, I think you got a bit of dad back. And he laughed, and he ironically, I think in that moment, knew exactly what I meant.
Yeah.
I said, look, if we were being, a bit zoomed in and whatnot, we're probably looking at a bit of a facet here, but I don't think that really matters. I think the reality is, you've got a brand new baby, and I know you haven't slept the last 3 or 4 weeks, yeah? Lots going on, suddenly picking up this baby all the time. I'm not surprised your back's going, I'm not feeling all that great. You know what I mean? And actually, that's quite laced with context.
Yeah.
And I think at that point, he was like, okay, I see what you're saying here. So yeah, okay, we did make him feel a bit better, a bit more comfortable. And then now, let's just, look, we're not worried. Let's just do a bit of this, bit of that, bit of movement here. You can even use a bit of painkiller and so forth. But look, things are going to be all right. Let's just check in a couple of weeks, see how we go. And then it plays out how we thought it would.
Yeah. And
then it was just about thinking, okay, for him, contextually, if the dad thing's real, right, which it is, there's a baby, right? Yeah. Like, how can he best manage this now in light of everything else going on? And I think it's just then thinking about, where we've spoken about allostatic load, about the other things that just take you over. Like, so practically for you, like, what can we really influence here?
Yeah.
So then we just try and lean into a certain few things and maybe keep him sort of happy and encouraged, right?
No worries. Go for it.
Well, we are at BCom.
This is it.
We are at BCom, and I was teaching this morning. So.
Yeah. Look. It's a working set, mate. It's all good. I'm aware of time,
Yep.
and I definitely just wanted to talk about, can we really prevent injury?
Ooh.
I think it's
Juicy.
because quite. I mean,
Juicy.
might have to speed run through this a little bit.
We've got a bit of time.
And like my kind of reason for asking that question is, I think I see a lot of people putting out programs of bulletproof your knee, bulletproof your shoulder, bulletproof your back, and like I actually really don't necessarily like this term bulletproof, because I think that and I'm going to put my own bias out there, and I'm going to kind of see sort of what you think. I don't necessarily think this is a conversation that we've had before, but I think that sometimes injury and sort of pain is sometimes reflective of just having enough skin in the game. You know, like if you are pushing the demands of your body, sometimes your body's going to push back. Yeah. And that might be injury, that might be a bit of non-specific ache and pain. And I think that sometimes there are people who are doing bulletproof your shoulder programs and can still feel shoulder pain. And that doesn't necessarily negate the program. I think people doing anything to make themselves more strong, resilient and robust, like I think that is a great thing. But I think we even look at athletes who are physical specimen and who are training all the time, resilient, not necessarily have too much else on their plate in terms of their only goal is to perform as an athlete, and they can still get injured. And so like sometimes I think can this be more damaging than it can be helpful? I'm going to put all of that out.
I almost don't know where to start, because there's so many different layers to that question, right? The general thing is this: I think people who are putting those sorts of programs or that sort of message out there have the best intent.
Yep.
And I do believe that perhaps at a baseline level, if you were generally a bit stronger, a bit more robust, you are probably putting yourself in a situation where there is a degree of resilience. But on the flip of that, there's always a bit of an orthopedic cost to being active, right? Especially in a sporting context or something where things are outside of your control, you know, shit happens, right? So I think what we really should be saying perhaps is, I think it might just be more of a marketing thing. You're trying to spread a positive message, and I do believe those things are good, and I do believe those things are beneficial. Where it starts going wrong, and things that we can't control, are all the other variables. So me today, training with my current training load, 4 or 5 jiu-jitsus a week, a couple in the gym. If I'm 10 weeks into dieting, am I in the same context now? You know, if my daughter suddenly starts, I don't know, she's got all her teeth, thankfully, but I don't know, gets ill, gets a flu, and she's calling daddy in the middle of the night, and I'm suddenly not sleeping, but I still keep doing the same thing. Like, things have changed, right?
For sure.
I think the thing is we've got to be careful about big promises.
Yeah.
Right? So I don't think we should necessarily not do certain things, but I think it just opens a larger can of worms. And I think what we realised is we can make predictions based on a bit of data, and there might be consistent themes, and we can lean into different things, the allostatic load, the sleep, the training, biomechanics in some contexts, right? And try and refine those things. But I don't think you can ever truly, like, definitively prevent, because then there's also genetics, predispositions, and all these other weird and wacky, wonderful things. So it's kind of like a bit of an, you know, almost like an unanswerable question in some ways, because the boxing yourself in any distinct box definitively, you will all, by nature, you are.
There's going to be outliers to that. There's going to be people that sit outside of it. And I think that it's such a sensible answer from you in terms of the other things that are sort of aware of, and like that's almost, I think, where sometimes it can almost rub me the wrong way, and part of me thinks I should just be more mature and be like, well, they're doing that, and like, as you say, people I think are doing these with the best intentions. However, I feel like when it's almost like sold on as a bit of a like flippant purchase, as a bit of a bulletproof your knee, like as if it's that simple. And I think for some people there is so much more context to go into. Now, arguably, probably that investment into a bulletproof your knee program isn't as much as coming to see someone a couple of times to really get a thorough understanding of those, and some people might not need that. There are probably thousands of people that go through these programs and see success. But does that invalidate the other people that aren't seeing success?
It's like a bang for buck narrative, isn't it? Where if I can say one thing, just go and try and be a bit stronger and fitter, and you'll probably have less problems in your musculoskeletal system, metabolically, and all these other things that we know that exercise is good for, say. Then I feel like pretty content that that's a pretty good answer.
Good message.
I think the thing is that, like, the more you know, the more complicated it is on paper. You almost feel like, I can't really say that, you know?
Yeah.
And I think that's what you're struggling with now, is you recognise that there are many facets. And when someone goes, it's only this, you're like, it's not though. That bothers you, right? But I still think that, like, if people are buying something that is inherently generic, because it has to be generic if it's on a multiple thing, you know, bend my knee, get my knee stronger program, right? I have to make a lot of assumptions. And I can pitch those assumptions at a level that might tick the majority of people, but some people just won't be ticked, because there are those other
outliers,
right? Yeah, for sure. And that's probably where, like, having something that's more personable might be better, right? Even if we look at the best strength conditioning programs in the world, I'm pretty sure all athletes are squatting, lunging, deadlifting, push pull pressing, right? They're all doing that. They add a bit of specificity, get a nice little buzzword, throw in there for their respective sport. Someone will be trying to reinvent the wheel, try and make it look really like sport or whatever they're doing, just to validate their job. And then you'll also then perhaps ideally have a bit of the person on top of that. So, for example, let's say, even with me, for example, I've had a bit of a right shoulder history, and I've had surgery in my left knee 17 years ago now, right? So there are some stiffness and stuff that I can kind of get. So my program would be the fundamentals, the bang for buck, maybe a few things that look, or maybe help me feel like, at least, that makes my jiu-jitsu better, either positionally or like range of motion or something like that. And then I'll add Tom on top of that. So that would be the ideal, right? But you know, if we're only going on a general capacity, then we're probably missing a lot. But I think probably people know, I would know, and I'd hope others would know, that that's not the gospel, right? That's not the only thing. And if you really truly want something personal, then only really seeing someone can do that. But even then, even though I've said all of that, I don't know if I could definitively say that, well, if we added a bit of personal, would we get any additional benefit?
Or like, even if there were benefit, how much benefit could we attest it to, right?
This is it.
Is it potentially worth it adding that in? If it's only going to be an extra, I don't know, couple % more, given the extra effort that we're going to put in, and that sort of bang for buck.
This is it. And this is ultimately what you decide with your clients, with your patients. Like, how far down the rabbit hole do we need to go, right? And it kind of comes back to this thing where, like, I think that's just because I don't feel like I can say it, but I have seen that making it more personal to someone means that it means more.
Yeah.
So therefore you're kind of involving people more intuitively, subjectively. And I think that is important, because then again the message comes down to about making it about them. So they become more involved. So the more involved you are, the more intuitive you become. You make maybe better decisions over a longer period of time. The irony is we almost can't do it over a year, like a lifetime. So for example,
there's a dynamic nature to that, isn't there, where things chop and things change.
I used to lift really, really heavy, right, all the time. And now, even though my body, like, people used to be like, oh, Tom, man, you used to be strong, and I just didn't like that. Right? So I was like, man, I'm going to get strong again. And I did. I went and got strong really quickly again, and I felt really good, and it's all, look, I still got it. But I didn't like it. I didn't feel like my body wanted that. And again, that's just purely an intuitive feeling. And actually blending a bit of the stuff that we know is better on paper with what I just feel like feels better.
Yeah.
With a bit of experience, trial and error, a refinement over time, I am now doing a version of training on paper as an amalgamation of those two things. And it's
another label though, isn't it? It's like this hybrid training.
Yeah, hybrid, whatever. But I would just argue that it's just a bit of a intuitive experience version of my own training, right? It's Tom's program. It's not anyone else's program.
Exactly.
And I feel like that actually has now made me feel like I'm in complete control of how I feel. I'm more consistently feeling better. I have a lot less niggles and injuries and so forth. And that is something that is personal and more refined. But you almost have to earn that by being invested in it. And that's the thing.
I mean, training age at this point for you...
Long time. Like, and I've got a lot of knowledge, right?
Yeah.
So, but what I mean is like, even if you were working with someone, I'm sure, as long as we don't become complacent with people, like I know them, we know the deal, we train out, we know how we're doing with you. But it's a reflection over time. Often people you've probably spent time with longer, you actually almost start to, even though maybe rate of progress slows down, that's the nature of training, right? You ultimately have a really refined system where you feel really dialed in, people feel better more of the time, a lot less niggles, a lot less injuries and so forth, and actually tend to be able to just chop and change at a moment's notice what they feel like they need, and it just keeps them moving, regardless of the load that comes in their lives, right?
Yeah.
I feel like people I work with, we can mediate those things really well now, whereas perhaps without that prior interaction, I'd ultimately be best guessing. So over a period of time, even if they left me, I feel confident that they would know how to self-steer through crazy, when you know about being on the block. You know so you know how to get through all the trippy nature of all of that, right? So that's where I think the value of being personal is. But that is quite a leap from a quick program that cost me X amount of money. So sometimes this is the entry. Investment. Oh, I like this. More of this. Come see me, right? But even if you skip that, come see me, there's also a bit of a mutual decision about how far do we go down that rabbit hole.
Especially early on as well, right?
Exactly.
Because it sort of has to get there organically. But yeah, as I say, definitely sort of aware of time, and it's been absolutely incredible to pick your brains today. There's so much more that we could have gone into, so I'm sure we're going to be doing a part 2, a part 3. I'm like willing to come in most Thursdays and make it a regular segment.
If people want it, then we would do another one. But obviously, if you want to do...
Fuck what they want, it's for me. It's all for me. But yeah, no, mate, I really, really appreciate your time. I think like one sort of final question for me is sort of like what's sort of like next for you? What are the kind of things that you're starting to be interested in, invested into, sort of exploring, sort of like in your own practice, in your own training, in those sorts of things? What's sort of like guiding you at this sort of phase in your training age and your professional sort of experience and stuff like that?
Yeah, it's tricky. I mean, as I've sort of come into a bit more teaching now, in healthcare and outside of healthcare, I have a bit of a different lens now, and it's made me more reflective, because you always get asked really unique and interesting questions. So it sort of exposes you to different areas again that actually a lot of people think very differently. So for me now, I feel like there's always opportunities to refine and become aware of the new things that are emerging and where we might be going. There's always a fad or two out there, right? That kind of comes with that. But I think the biggest thing that I feel like I'm finding in clinic is, again, I'm really enjoying this sort of communication side, and I'm leaning into other aspects of that. And I'd like to do a bit more formalised training in that to see if I can make that better. Because I find that actually, regardless of whether I have a difficult patient or an easy patient, I feel like I'm getting to this point now where I can connect and be on level with someone really quickly now. And it makes the whole journey feel easier. And I really enjoy that, because I feel like I think the thing is there are certain things we can't control in healthcare, right? And there's certain things we can't always mediate all the time. But the more things I can, the more I can predictably take you to a better place, right? And that's where I'm enjoying it the most. And then outside of work is just gunning for a black belt, man.
Purple belt already, man. Is it,
purple now,
Yeah.
So, just enjoying it, man.
100%.
I kind of want to ultimately, I think, teach in that context as well. One day that'd be really nice.
That'd be cool.
But yeah, I just think, part of my wider team, just enjoying getting hard rolls in a couple of comps. I don't love competing. Dad life for me. I can't afford to be injured either. So
I think there's sort of like an element of like anything you've competed at as well. I think you've kind of always dominated, like looking at sort of like your ex-powerlifting career and stuff like that.
I think if I'm in,
you're quite a natural athlete, I think from that standpoint. Nice. And so I think while there's probably like a want and a desire to compete,
just a couple.
I think probably the cost that comes at in terms of family time, professional time, and all of those sorts of things.
I'm not that nice to be around, and my missus is nice enough that, you know, she might let me go to jiu-jitsu on a Sunday and all these sorts of things. So if I was like competing, I just turn into someone who becomes overly focused about it, and probably not that fun or helpful to be around. So yeah, a few comps for me throughout, but yeah, just ultimately one day just want to land on something that's difficult to get, and another skill, another thing to throw myself into, man. So yeah, mate, I've enjoyed being on, man. Part two soon come.
If people want to sort of see more of you, sort of, I know that obviously you're sort of like going into new avenues. I'm not sure potentially how much sort of you want to say here is sort of in terms of like practice stuff and things like that. But if people want to kind of see more of you or sort of find you, sort of what sort of like the best areas that they can sort of message or sort of get in contact with you or sort of follow a bit more of.
I suppose if anyone had any specific questions for me, then obviously I have like an old fitness account, which is at Spark Power Fitness. You can just give me a little cheeky message about something in that context. But yeah, I'm as some of the professional things evolve and another avenue potentially opens up, hopefully we can do a few more of these that where I can sort of direct people if they wanted to ask me something more specific. But
100%.
Yeah, for now, otherwise I'll be operating in private practice, teaching at Beacon. I'll be dotted around in Oxfordshire. I'll be around.
Awesome stuff, man. Tom, thank you very much for your time, man. And I'm sure we'll be doing this again. Mate. So, but yeah, really appreciate your time. And I'm sure everyone else will as well. And I can't wait to do it again with you, bud.
Yeah, appreciate it. Good man.
Thanks very much.